Hello, 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 everyone. Welcome, welcome, welcome. Tonight, I have something extra special for you. Our guest is Jullie Hoggan, PKD patient, experienced kidney advocate, preemptive kidney transplant patient, co founder and lead navigator for Square Not Health, a telehealth company that helps patients overcome barriers to transplant and kidney donation. Jullie was diagnosed with polycystic kidney disease at the age of 26, and despite her best efforts to keep her kidney function stable, she spent 20 years watching it fall. Jullie was the grateful recipient of a pediatric en bloc, both small kidneys from a child type kidney transplant in 2020. Jullie was fortunate to receive this gift prior to going on dialysis, so it was a preemptive kidney transplant as well. Jullie has been doing relatively well since her transplant. Jullie is the co founder and lead navigator at Square Not Health, a telehealth company that helps patients navigate kidney disease with the support of a transplant nephrologist and a transplant patient navigator. Square Not provides pre assessment of kidney transplant candidacy to identify barriers to transplant, helps patients become listed for a kidney transplant, supports patients in starting a living donor search, and works to help patients overcome barriers to transplant or kidney donation. As a result of her gift, Jullie has become a very, very active kidney advocate. She is a member of the PKD Research Resource Consortium Patient Engagement Group. She started the Las Vegas chapter of the Polycystic Kidney Disease Foundation and was the chapter and work coordinator for over 4 years. She is the facilitator for the Living Well with Kidney Disease Support Group in Las Vegas, and they welcome anyone with CKD and their caregivers. Jullie has participated in multiple clinical research trials and observational studies for patients with PKD and kidney transplant. And just folks, just so you know, if you go to my Facebook page, the original broadcast is what's going on right now is pinned to the top of my page. In the comments, all these things that I mentioned about Jullie are there, and the links are there. So if you want to drill down a little bit, or you want to learn a little bit more about these subjects, that's available for you. Okay. Jullie has been a patient advocate for many, many years, and she's been featured in publications or interviews by the PKD Foundation, the Renal Support Network, National Public Radio, the Las Vegas Review Journal, the Clinical Journal of the American Society of Nephrology, and most recently in an updated version of Risa Simon's book, In Pursuit of a Better Life, the Ultimate Guide for Living Kidney Donors. She's a very, very active individual with Kidney Solutions, a volunteer mentoring and support group for kidney patients. Jullie holds a master's degree in speech language pathology from the University of Utah. Her first job was as a hospital based speech language pathologist. She worked for both pediatric and adult patients who had swallowing and communication disorders for 24 years. I am very happy to announce. Please give a warm welcome to our friend, Jullie Hoggan. Jullie, how are you tonight?
I'm great, Jim. Thank you so much for having me. It's a real honor to be here.
Oh, it's great to have you. So much to discuss.
Yeah.
So let's get right into it. Did I
Okay.
state everything correctly in the introduction?
You did. You did a great job.
Please tell us a little bit about where you grew up, your education, and your employment experiences.
Sure. I was actually born in Minnesota, but when I was very young, my parents moved to Salt Lake City, Utah, and so I mostly grew up there. And I went to the University of Utah, as you mentioned, and I received a master's degree in speech pathology. I realized sort of as I was going to school that I wanted to work in in medicine, in medical speech pathology. and help people with swallowing disorders when I took a patient that I was working with to have her swallow study. And it was really exciting to see the imaging and the work that I would be doing in the future. So I loved my job working in hospitals. I did my first year in a hospital in New York, in Albany, New York. And I had great training there. And then I came to Las Vegas. We were trying to get closer to home. We have lots of family in Utah. And so we came to Las Vegas, and I've worked in several hospitals here over the last 24 years. And it wasn't until the pandemic that I stopped working as a speech pathologist. So.
Okay. I understand that you are a married lady, correct?
I am. My husband's name is Rich, and he works at the police department here in Las Vegas. And then I have a daughter named Maddie, and she's 24, and she lives up in Corvallis, Oregon. So.
Okay. And my mom told me I'm never supposed to ask this question, so I'll ask it this way. What is your date of birth?
Well, I was born in March of 72, but I'm 52, so it's okay to ask.
Okay. Don't tell mom.
All right, yeah.
I understand you no longer work as a speech pathologist. What kind of work do you do now?
Yeah, I had a really amazing career change. And again, it was mainly because of having a kidney transplant and having the pandemic start sort of the same month that I had my kidney transplant. And so I came home after my kidney transplant and realized that, while I had planned to go back and work in the hospital, that I would be working right in COVID ICU, and I was newly immunocompromised, and that just seemed not reasonable. And so I was waiting and hoping to sort of figure out what to do when I met Dr. Elliott here. And he's a transplant nephrologist in Boston. And through a patient of his named Lauren that I met on Renal Support Network, we were introduced. And Lauren had said to me, "You should really talk to him. You guys think the same about kidney transplant, and making sure people understand that that's an option early." And I was a little hesitant, and she really had to keep bothering me to get in touch with him. And so when I did, we met, and she was correct. We do think very much the same. And he was working at Mass General Hospital in Boston as the medical director of their kidney transplant program there, when he realized that there was a big gap in care. As far as, he made a lot of changes there that really improved their program. They transplanted more people, and they got more people listed. But he still felt like people were coming too late. They're coming when they're already on dialysis. And we have all this time before they start dialysis where they could be gaining wait time. They could be finding donors. And he really wanted to be part of that solution. And doing that from inside of the transplant center is really tough because they're already overloaded. They don't have the resources to do all of that work. And so getting patients to them, is really the trick. Once they're there, looking for a donor and doing those things can happen, and learning more about transplant can happen. But it's pretty hard to find a transplant nephrologist out in the community before you reach a transplant center. It's kind of not a thing. And so bringing Square Knot, out into the community to help people find out more information about what it takes to get listed. Would they qualify? How do I find a donor? And sort of doing that in a way that, it doesn't require a whole transplant center full of people was a hard problem to solve, right? We can't really produce a bunch of transplant nephrologists to have them do this work. And so his really innovative and interesting thought was that maybe I have patients help me, right? They have this whole other experience that's really different, and that's, patients helping patients. We know that helps, right? People like that. It's why people come to support groups. It's why they seek out others who have their same, disease or problem. So it's when I met him and he described that, he wanted to hire people who were living donors, who were transplant recipients, who had chronic kidney disease, and who had been through all of these hard things that we all go through. I just couldn't believe that he really wanted to do that. I was so excited because, I'd always wanted to. I loved my job as a speech pathologist, but there was this part of me that always really liked to help people understand the medical system and sort of how to get through it, the questions to ask, and sort of, how to manage with whatever it was. Not always kidney disease, but with anything. And I'd never really figured out a way other than just helping family and friends and, people through that. And then to have, to be waiting around for a year and kind of wishing I could go and do something to help in the kidney world. And then to have him show up and say, here's the thing that, I want to work on. And could you come and work on it with me? And it's exactly what I would love to do in every way. It seemed like kind of a miracle. So it was really exciting. Our goal at Swear Not is to help, patients and to have navigators who've been through this. So all of my colleagues are recipients, have family or friends who have, received kidneys or who have kidney disease, living donors. It's an amazing group of people, to have working as a team with Dr. Here. So of course, this is my favorite thing to talk about, and I know we'll talk more about it later, but that is what I do now. I'm the co-founder. Dr. Here founded Square Knot, and I'm also manage the practice, and I'm a navigator and sort of lead the others that are navigators as well.
Excellent. One of the things that we were talking about before the broadcast started tonight is we were talking about the importance of GFR. Can you tell us in terms of your work why EGFR is important?
Yeah, I'm glad you remembered that. One of the things that we really emphasize with our patients and with all patients who have kidney disease is to know your GFR. And the reason I want to talk about this is because I'm going to mention mine. And I guess, if there's people watching who don't know this number, it's sort of important that they do. But the way that we talk about this is a lot of patients will receive a patient and we'll say, what do you know about your kidney disease? And they'll say, I have kidney disease. I don't really know what that means. Or I know it's stage 4. And they don't really have a frame of reference. Some of them even know their creatinine. They'll say it's 2.8. And I'm like, well, what does that mean to you? How does that help you understand your kidneys? And they're like, I don't know. But so then we'll say, all right, well, there is this other number. If you look at your labs, and it's called the GFR or eGFR. And the E just means estimated. It's a little e usually on the lab sheet. And then the GFR is the glomerular filtration rate, which is a lot. That's why we say GFR instead. But it just tells how well your kidneys are functioning. It's the biggest, most important number to know when you're thinking about how your kidneys work. And it's, in theory, it's just a number between 0 and 100, right? So that makes it really easy to understand. So if your GFR is 90, you have 90% of your kidney function is there. And it's not exactly what it means, but it's an easy way for patients to think about it. It's really how much blood your kidneys are filtering every minute. But thinking about it this way is so important because there are milestones that you need to remember when you're thinking about your GFR. So if your GFR, for me personally, when my GFR hit 29, I thought I need to start thinking about preparing for a kidney transplant. That's really critical. And 29 feels really early to most people. And even to nephrologists, I think that feels really early because they know that they can't refer you to a transplant center usually until your GFR is 20. Some transplant centers will let you, will evaluate you when your GFR is around 25. But if you haven't planned ahead when your GFR is 29 or even 35 or 40, how can you be ready? How can you be ready by the time your GFR is 25? And so that number 20 is when transplant centers across the country will see a patient and evaluate them to determine if they're a good candidate. And if you don't know that number, if the only number you know is your creatinine, there isn't a milestone. There isn't a number that we can say, okay, when your GFR is 2.95, you can go to the transplant center. When your creatinine is that. And so there's not a good way to understand when to act when you're looking at it the other way. So it's really important to look at this GFR. There's one other number that we find really important, and it's the UACR. And that's a urine albumin creatinine ratio, or microalbumin creatinine ratio. And the reason this one is so important is that it tells you if there's protein in your urine, a certain kind of protein called albumin. And when that is the case, it's really important to talk with your doctors about what that means. It just means there's protein leaking through the filters in your kidney and making it into your urine. And so it indicates that your kidneys aren't working as well. And it also indicates that you might see more progression of your kidney disease over time. And so those are the two numbers I just want people to, I want to be really clear that everyone should, if you have anyone's ever told you have kidney disease, those are the two numbers that I hope everyone will look for. And if they don't know them or can't find them, they should ask their doctor about those.
Excellent. Excellent. Let's talk a little bit about your experiences with polycystic kidney disease. When were you first diagnosed?
So it was interesting. I was 19 when they found I had high blood pressure. And initially they just sent me back, I got sent to my primary care doctor, and he said, well, your blood pressure's high. I'm going to put you on a blood pressure medicine. And I really clearly remember this because at the time, I was only 19, but something about it struck me and it stuck in my head. He said, there are some things that can cause this, but you're too young for that. And so I went on my way and took my blood pressure pills, and it was fine. And my blood pressure was well controlled. But it wasn't until I went to go, I was considering getting pregnant. And so I just moved to Las Vegas, and I went to my new primary care doctor. And I said, I'm looking to change my blood pressure medicine because I want to get pregnant. And he said, well, why do you have why do you have high blood pressure? And I was like, I don't know. And he said, well, do you have any kidney disease in your family? And I said, no. He's like, well, I'm going to send you for a kidney ultrasound. And so I was like, all right. I did not understand that connection at this point. I just went and had the test, and the tech right away said, do you have any people in your family who have cysts on their kidneys? And I said, no. And then he asked again. And I said, so obviously I have cysts on my kidneys. What's going on? What does that mean? And then, he got quiet. And it turned out that the doctor who was going to read my x-ray, my ultrasound, was someone I sort of knew from the hospital where I worked, because I worked in radiology doing swallow studies. And so the tech told him, and he came out and he said, hey, Julie, you have polycystic kidney disease. And I was like, with the face of like, I don't know what you're saying. And he kind of then started looking nervous, and he goes, don't worry, it's not cancer. And I was like, I don't think that helps. It was a really kind of tricky way to learn about this. And we were just standing in a hallway, and there was obviously no opportunity to ask questions or to try to understand. So I left just pretty scared. And when we started looking it up, it was 1998, right? So I was 26, and there wasn't a lot online. It was hard to find information, but we found enough to be pretty scared. There's, aneurysms and heart problems and other things that can be associated with polycystic kidney disease. And, it was super scary. Of course, I didn't have a nephrologist, so I had to wait to get an appointment. And when I went, things didn't really get better. I basically was told, your kidneys are working just fine. And they were. My GFR was, I don't know, 70 or 80 or something. They were, the GFR was okay. But obviously the pictures on the ultrasound showed my kidneys were enormous and filled with cysts. And he basically said, your kidneys are fine. Come back in about 20 years when your kidneys fail. And he said that to me. And I was like, I feel like this is not a good answer to this either. And, back then there weren't really lots of things to do about PKD except for control the blood pressure, which, we were doing. But just that sort of delivery of that, the way he said that. And to give him some credit, he wasn't really that far off in when it would happen. It was about 22 years, actually. But I don't know. It's not a great thing to say to a 26-year-old, who's just learning this information. So it was, it's hard to be that age. I mean, to be any age and have a diagnosis like that, that's so scary, and that you have so long to think about, right? You have 20 years to think, how's this going to go? What's this going to look like? And I would say it took me probably a year before I didn't wake up and immediately think of it first thing, and didn't kind of think about it a lot during the day. And I mean, eventually I kind of got used to it and, could think of myself as, before I was a healthy person. And then one day I wasn't, and really nothing had changed, but the way I thought about it really did. So it was hard. I do think that if I had learned at 19, I think it would have been harder. So I actually am sort of glad that first doctor just treated my blood pressure. Not that that's necessarily the best thing for everyone, but I think it would have been tough at that point to learn that information. And it could have made, I don't know what it would have done, but, I don't know if it would have changed anything. But in the interim, I finished college, I got married, I started my career. So I think it all worked out probably the way it should have. But the other weird thing that happened is my parents had to get tested because we assumed, this is an autosomal dominant disease. And so we assume one of my parents has it and they just don't know. And so I had to tell them, so by the way, I was diagnosed with this thing and it's kind of scary. And one of you probably has it. So that was awful. And then they were both tested. Actually, their doctors said, don't go get tested. We don't want you to do that. And so they both decided they wanted to get tested, but they kind of did it off the books, paid for it out. This was back when if you had a pre-existing condition, you were in trouble. And so they didn't want that on their records. Anyway, either way, in the end, neither of them have it. So it turned out that means I was my PKD was the result of a genetic mutation. So it's unusual. It's about 10 or 15% of people who have PKD it doesn't come from a specific parent. So.
Okay. I read, and you've mentioned tonight, that the condition of your kidneys continue to deteriorate over the next 20 years or so. Mm-hmm. Can you please describe to us what happened over that period of time?
Yeah, initially, my kidney function was good. And after I had my daughter, there was a point at which I looked at her and I just thought, I mean, we can't keep waiting around, like not doing anything. And I started looking for clinical trials because I knew I wasn't going to get pregnant again. And I was not a good pregnant person. I just had a lot of complications and it was really tough. But so I felt like I wanted to do something, right? I mean, I wanted to get involved in some way. And it took a long time. There wasn't a lot where I live here in Las Vegas. There wasn't really research here. And so I kept looking, and through the PKD Foundation, I did find the tolvaptan trial, or it was called the Tempo trial at that time. It was around 2006 or 2007. And as soon as I saw it, I called him up and I was like, send me the paperwork, whatever you need me to do, I'm in. And I hadn't talked to my doctors or anything. And I was just so excited that there was like a thing to do. So it was a double-blind clinical trial where I didn't know if I was going to get the medicine, like the real drug or the placebo. And that seemed fine to me because, either way, we need to move this stuff forward. And so I had to drive down to California about 4 or 5 hours every week for a couple months to get started. And then for 12 years, I drove back and forth to LA and would have an appointment, get my medicine, and then go back home. So it would be this big, long 10 or 12 hour day every 3 months. But it was awesome. It was so fun to be in a trial and to have access to these great researchers and doctors and, to feel like I'm even in a little way helping to move something forward so that, if my daughter does have this disease, that there's more options for her, that they won't tell her, oh, come back in 20 years when your kidneys fail. I don't want that to be how it is. So the cool thing about it is that because I was in the trial so long, it actually became an FDA approved medication while I was on it. So that's pretty neat. I don't know how often that happens for people when they're in a clinical trial, but so I stayed on it a little bit past that and then transitioned to taking it as a prescribed medication after some insurance fighting and, all the things that happen. So that happened. And then also during that time, I met my first friend with PKD, and she was a nurse at the hospital. And I was so excited to find another person that had the same thing. And she was similar in age. We both had little kids. And it's when I realized how important having other people with the same problem was. And so then I thought, well, we need to find more of us. There's got to be more of us here, right, in Las Vegas. And so that was when I thought, well, we need to start a group here. And I got in touch with the PKD Foundation, and we started sort of the chapter. I was more interested in the support part of it and the support group. And then they also wanted us to do the walk. And so we did that and, raised money every year. But it was so fun because it was a group of, this relatively small group of us. And we would just get together and talk about PKD. And, Jim, PKD is weird in that there's, you're okay for kind of a long time, but there's all these sort of scary thoughts in the future about how this is going to go, and that anticipation and the worry. It's, I didn't talk a lot about that with my family because I don't want to scare them, right? I'm scared enough for all of us. And so it was so great, though, to have other people in a similar situation thinking about these similar things and be able to talk about it and kind of, come to terms with it, deal with it, and feel like, you're not the only one out there with this thing. So that was super helpful. I also joined a genetic study at that point, during that time, trying to find what were the genetics of my PKD. So, yeah.
Okay. You mentioned the genetic testing. What did you find out?
Yeah, it was interesting. So the first study I joined was out of Colorado, and I just had to send in, the sample initially, and it took a really long time. I think it was, I don't know, a year or two. And one day I was like, hey, I wonder what happened with that. So I just called him up, because you just send it in and that's kind of the end of it. And so I got the sort of main person for the study, and she said, oh, you're one of these. And what that meant was that they couldn't find that I even had PKD in their study. And I mean, obviously, clinically, I had PKD, but they were looking for, it was hard to find the PKD1 mutations, which is what I had. So that just means PKD2 is, it's easier to find. And the PKD1, the mutations where it came from, it didn't come from a parent. So something went wrong. They're harder to find. And so she said, well, this will sit here and it might flip into another study at some point, but, we don't really have the answer. And so quite a few years later, this was actually probably maybe 2018, my nephrologist said, hey, do you want to be in a study? And I said, yeah, what is it? And he said, they're trying to find these PKD1 mutations. And I was like, yeah, that's exactly what I need. I would love to, know more. So I, again, sent in my stuff, and it only took like 6 weeks or something. It was really fast. And this company was just testing, trying to find, an easier way to find these mutations. And they sent it back. Here's your mutation, novel mutation, different than what they'd seen before. It wasn't in their database. I don't know if it, is that unusual still or not. But so it was really interesting to find that out and to read about it. And I actually don't remember exactly what it says. Now it's been a while since I looked at it. But the really cool thing is that not too long later is, when I was starting to go down this path of needing a kidney transplant. And my daughter said, I want to donate to you. And I was like, no, that's not a good idea. And she said, well, I want to be tested for PKD at least, and we'll start there. And so I called the company who had done the study and asked, now is your test ready? Can I, get it for my daughter? And they said, oh, we'd love to test her since you were in our study. And so same thing, sent it in, got it back, and she does not have PKD, which is amazing and such a relief. She's obviously my only daughter. So really in my family, PKD starts and ends with me, which is great. I very much am aware, though, that, in most families with PKD, it's, so many people, right? Every generation, there's multiple people in most cases. And it's really devastating, and the experiences that people have watching parents and grandparents and aunts and uncles and cousins go through all this. I mean, it's so much, right? It's so hard to deal with that in a family just over and over again. So, um, I'm so grateful that my daughter doesn't have it. But it still feels to me like there's awful lot of work to be done, to try to figure it out and to find better treatments. The treatment I was on was fine, but it works. It slows the progression, but it doesn't stop it, and it doesn't roll it back. So it helps, but it definitely, it's not going to be our best treatment in the long run. We hope to have something that will really, prevent the need for transplant and dialysis.
One of the things that I found interesting in your story is that you were seeking a preemptive kidney transplant to avoid going on dialysis very early on. Can you explain why your original preference was for a preemptive kidney transplant with a living donor versus a transplant with a deceased donor?
Sure. I actually am not 100% sure where and when I figured that out, but I think it goes back to not too long after I was diagnosed. I worked in a hospital, and I worked in the kind of acute care part of the hospital. So people are sick, they're coming into the hospital with lots of different things. And, there's plenty of them on dialysis. And I would arrive in their room to do something, a communication evaluation or a swallowing evaluation, and they would be on dialysis. And so I'd have to check with the tech and see, can I do this right now while this is happening or not? And of course, when I was diagnosed, the first thing I thought the first time I walked into a room where someone's on dialysis was, I flipped myself into their spot. And I thought, wow, this is scary to think about being in this place, right? And um, at some point along the way, I went looking online. I mean, I never really talked to my doctors about it that I remember. I just remember looking around and reading about both and thinking, well, this transplant path seems like the right one for me. If I can work that out. I mean, and at the time, I don't know how much I knew about the facts surrounding preemptive transplants and, transplant before dialysis. But certainly now, I mean, understanding that, when you get a preemptive kidney transplant, obviously you avoid dialysis. So all of the complications, the dialysis access, feeling poorly, which many people do while they're on dialysis, not everyone, but a lot of people don't feel well, at least, some of the time. And, the cost it's an amazingly huge cost to go through dialysis, year in and year out for however long it takes to, hopefully get a transplant. But if you can avoid all of that, you stay healthier, right? It's easier to get listed for a kidney transplant preemptively because you haven't already accumulated the problems that come with dialysis and the complications. Um, and, when you then add in a living donor, what that means is that the kidney works more quickly. It, oftentimes works right on the table. They put it in and it starts producing urine before you're even closed up. It's amazing. And that can happen with a deceased donor too, but with a living donor kidney, it happens more often. And then those kidneys last longer too. So they last, more years on average. And so it just all the way around, it seemed, I mean, it didn't seem like any comparison. Um, with dialysis, it's a really tough treatment. I mean, because you did it. Um, it's it's really hard. I mean, often people can't keep working after a period of time. I mean, some can, and they're tough, man. Those guys that can keep on working, boy, it's really hard. And a lot of people now are doing dialysis at home, which helps. It can make it easier to work, but it's a lot, and it's many, many hours a week. It's like a part-time job, we like to say it's a part-time job with no pay and no vacation. And you feel it's terrible. And so, and it's life-saving too. So I mean, I'm not saying it's not a great, thing for us. It's a treatment that is amazing. And when it's needed, right? I mean, that's the choice if you get to that point and you absolutely must do it. However, if you could avoid it, I think almost everybody on dialysis would say, if I could have avoided this by doing something else, I probably would have. If I'd have known early enough, I would have done that. So for me personally, looking at this as like a young person, right? I was in my 20s and 30s as I'm thinking of these things. It just didn't seem like there was any question that that would be the right way for me. So that was, I mean, I didn't know all the things I know now, but it seemed evident when I looked around online and read about it.
Okay. Let's talk about when you were evaluated for a kidney transplant and when did you first begin your search for a kidney donor?
Sure. Well, so I know I mentioned before when my GFR went to 29, I was like, I feel like this means I need to prepare. And I went to my doctor and I said, hey, just so you know, I'm not doing dialysis. And he was like, all right. I mean, in agreement, but was sort of, I mean, I think he thought I was talking about this kind of early and maybe not, but I was very, I voiced my preference early. And I said, I want to go down this transplant path and whatever we need to do to make that happen is what we need to do. So, I didn't know a lot, I mean, I was learning just like a lot of people do as you go through it. But so at that point, I thought, well, I better figure out when I can get seen. And so I called the center here where I live in Las Vegas. And I said, what do I have to do to get seen? What do I need to do to prepare? And what point, like, how do I know when I can come? And they told me that when my GFR was 19, they would see me. And she did. I was very helpful that she went through and said, you need to make sure you have your dental work taken care of. You need to make sure your weight is close to where it should be. You need to make sure you're up to date on all the vaccines that are recommended. You need to make sure your cancer screenings are done, for whatever your age and gender is. And so it was great because I was like, make sure you've seen your primary care doctor and done a physical. And so all these things were things that, I generally did. But for example, the dental work, there was a thing that we were watching on my teeth. We weren't sure if there was a crack or not, but we kind of let it go because it wasn't doing much. But I went in and I said, okay, we're doing this, whatever you need to do to make sure of what's going on there. We have to take care of it because I have this thing coming up and I don't want this to stand in the way. Right. And dental work can be expensive. It can take multiple procedures to get things done. And so it's just an example of one of the things that if you know ahead of time and you can prepare, let's do that, right? Rather than waiting and have this delay getting listed or delay a transplant. Because you can't have an infection. You can't have problems going on in your mouth that, after a transplant, you're immunocompromised. And so you can't have problems that are, ongoing when they list you. So the other thing I did was at this point, as I called my insurance and I said, so where can I go? I wanted to understand how my insurance worked. And so the first person I talked to said, well, you have to stay here in Las Vegas. And I was like, okay, it seems like that's not how this works, but all right. And so then I thought about it for a while and I thought, I'm going to call again and just see if I get the same answer. And I got someone different and they said, you actually have to leave Las Vegas. You can't stay here. And I was like, all right, well, the guy yesterday said I had to stay. So which one is it? And they were like, no, you have to go. Because, saying like this, it's not on our list. And so I said, well, can I talk to someone else? And I worked my way through, I don't know, 4 people or something. And I got this guy and it was the luckiest thing. I feel like there's so many lucky things that happened to me, but I get him and I say, this is my problem. I'm trying to understand. I can't get a straight answer. I'm getting all these, different stories. And he says, it's so interesting you're calling. I just donated a kidney to my wife at Mayo Clinic. And I was like, really? And he's like, yeah, just last month, I'm just back. I was like, wow, you are the right guy to talk to. So he was so kind. And he said, well, what state do you want to go to? And I said, well, I don't know. I want to go somewhere that's, has a living, that has the paired exchange. Because I knew that the center here where I lived didn't have that. And I also kind of knew I probably had some people interested in donating. And so I wanted that to be an option, that if they didn't match me, that we could go into this paired exchange where we don't have to match, but they can donate to someone else and I can receive from someone else. And then, two people get a kidney, which is, it's an amazing system. So he helped me understand that I qualified to go to Mayo Clinic if I was accepted into this complex care program. And that luckily I was accepted, and it just meant I could go to Mayo Clinic in addition to being listed here where I live. And it would be paid like it was in network for my insurance. So I was super lucky to find that guy. And so I ended up pursuing both and becoming listed at both centers, the one where I lived and the one out of state that was about 5 hours away. But it took a bunch of doing to get all this information, multiple days and phone calls and trying to understand how this worked. And, it's a lot of work for the patient to sort through all this.
Let's talk for a minute about you're searching for a living kidney donor. Did you find it difficult to talk to others about your need for a living kidney donor, to ask for a kidney donation?
I did. And just like everybody else, I dragged my feet a bit. And I mean, I still did put the search out, but it took a lot. And it was, I knew I needed to do it. There were people in my immediate family who had wanted to donate, and there were reasons they couldn't. And so, a lot of the patients that we see at Square Knot will say, "Oh, I don't have a donor." And I'll say, "Well, have you done a search?" And they'll say, "Well, what do you mean?" And so I think what they mean is that they've asked their immediate family, "Hey, can anybody donate a kidney to me?" or whatever. And they've heard no. And so they stop. And that isn't a search. That is just sort of checking in with your family, right? This is not the same thing as doing a wide search within your community, within your personal circle, which is so incredibly important if you want to try to avoid dialysis or minimize your time on dialysis. And the reason I say that is that, the patients that I work with Square Knot are all in the northeast part of the United States, and the wait times there are quite long. They're not as long as in California, which can be up to 10 years for a deceased donor transplant, but they're getting up there. And it's to think that you get listed and let's say do it at just the perfect time. Your GFR is 20 and you were seen a little bit earlier than that, and you get listed right when your GFR hits 20. And then what if you have 6 years to wait? Or 7 years to wait before a deceased donor, before you might get to the top of that list? How many people can really avoid dialysis for 6 more years once they hit a GFR of 20? And some can, but some cannot. And so we don't know, right? We don't know who that's going to be. And so doing that donor search, it's really, really important to make that happen in some way. And lots of people do it in different ways. So the way it happened for me is I was trying to figure out what's the best way. Do we just post this on Facebook, or what do we do? And my daughter said, Mom, I'd like to make a website. And I was like, do you know how to make a website? And she's like, no. But then we decided, she said, well, I'll go figure it out, which was great. And so she went and she worked on it after a couple of tries and found one that was free. It wasn't this whole big thing. It wasn't something where we paid a bunch of money to go put it out to the whole world. It was just a place for us to sort of put everything. And then we linked it to a Facebook post. And she wrote the first part, which was super sweet. And it was, something along the lines of my mom's kidney function has been falling as long as I can remember. And now she's at the point where she needs a kidney transplant. And I'm hoping that, we can spread the word. If you guys can all help us, share her story. And, we hope to find a living donor for her. And just that little bit, right? That she was sort of starting the conversation. It was so much easier for me then to sort of help do the rest of the website and get up, put up information and links and things. Knowing what I know now, I would probably just say, let's just do a quick post on Facebook. It doesn't have to be that complicated, but there was, it was great that we had all of this stuff that people, links for people to go look and read about donation and, kidney disease and PKD and all of this stuff. So that if they wanted to learn about it, they could, and it was right there with, reliable resources. But once we had it all done, we were ready to post it. The post was written, and I sat there with my finger over that button for like 30 minutes. And I remember thinking, is there some other way? Like, is there something else we could do? And I mean, it just seems funny because it was ready to go. Like it was fine. It was, it needed to happen, but it was really hard. I'm used to being on the other side of this, like to, to be the helper, not the helpy. So it was hard to put it out, but we did. And the response was amazing. People were so kind. And, I've already done the screening form. I want to help. What I can't donate, but how else can we help? I mean, the response was it was amazing. People were so, so kind.
Talk to us a little bit about where you were listed.
Yeah, so I did end up being listed at Mayo Clinic and first, and so they started testing my potential donors right away, and right like as soon as I was listed, they were contacted, and maybe even like practically overlapping. And then I was also listed a little bit later in Las Vegas, where I live, which was closer. But I did end up having kind of directing my donors to be evaluated at Mayo Clinic, just because they do a ton of living donation, of living donor surgeries. And so they also coordinate their visits so that when a donor comes, their evaluation happens like all at one time and over the course of a few days or a week. And pretty much at the beginning, they see a doctor, they have all the tests, and at the end they see a doctor who says, we think you're a good candidate or we don't. So it made it really easy for them, even though they had to travel to be evaluated. So, and I was looking for something like that where, the donors would be taken. I just wanted them taken care of in the best possible way, right? If they're willing to go through this. So that was part of it.
Sorry.
No, it's okay.
Let's talk about a couple of your potential living kidney donors, Amy and Monica.
Yeah.
Let's start with Amy. How did things work out with Amy?
Yeah, so both of these guys, these are amazing friends, and we met we met through our kids essentially and through book clubs. So Amy, neither one of them told me that they were being evaluated until they already had an appointment with Mayo Clinic, and so both times I was just shocked. I didn't know, and I hadn't heard that they were interested up until they told me I have an appointment next week or whatever, and they're amazing people for sure. And Amy went through the whole process. She spent a week down there. And at the end, she was basically told there was just something that wasn't going to let it work. And she was so upset. I felt so sad when she called because it was just, I didn't realize she really was like, I'm going to be the donor. I'm sure of it. She was 100% sure. And so I felt really sad that she was so sad. But then almost right away, they contacted Monica next, and they are friends. And so Amy started talking to Monica about the process. So she was, navigating Monica and helping her understand how it was going to go before I even knew. And then Monica went through the process the week of February. It was the second week in February of 2020. And she, went through all the testing, and it was Thursday night. And that's kind of when, that was actually when I received the call for my deceased donor kidney transplant. And that's when things really kind of ramped up and got a little crazy. So we had an interesting conversation that night. And we knew even before that we're not matching blood groups. And so we knew if she donated that we would go into a paired exchange. So.
Okay. And the plans with Monica to enter the paired exchange program, that did not come to pass, correct?
Not. No. And it was interesting. there were some things I actually found out later that, they were talking about trying to work all that out even before sort of the end of her evaluation, but it never ended up happening, because I received the call for the kidney that night, the night before she was about to sort of finish her evaluation at Mayo.
Okay, let's talk about that evening when you received the call, February 13th, 2020.
Sure.
Tell us a little bit about what happened.
Yeah, so I got called when I was on my way home from work. I turned my phone off, and I had not, I'm not supposed to turn off my phone when I'm listed for a kidney transplant, but I'd only been listed for 3 months. And so it didn't seem that ridiculous to turn it off for 10 minutes while I was driving. And I get home and my husband's standing in the garage and he says, Mayo Clinic needs to talk to you. And I was like, okay. And Monica was there. And so I thought it's just something about her. So I'm sort of slow getting out of the car. And he's like, no. Like, they need to talk to you about a kidney offer. And I was like, I think that's not correct, but okay. So I went in and I called and I get the coordinator and she says, how are you feeling? Could you travel tonight? And I said, I don't think you're calling the right person because I've only been listed 3 months. I have a donor there testing right now. She's probably going to be approved tomorrow. So, does this make sense? And she was like, this is an offer for you. And it's actually 2 kidneys, not just one. It's 2 little tiny kidneys from a baby. I was like, what are you talking about? Like, it just seemed, I'd done a lot of reading by this point, and I was like, I don't even understand what you're saying. And she's like, yep, this happens because these kidneys cannot be separated, that you would be receiving both of them. And she didn't say the words pediatric en bloc, but that's the type of transplant it is. It's 2 kidneys that are not separated, and given as one organ. But it was, so surprising. And I said, all right, listen, can you go ask the surgeon what I should do? Because I don't know if he knows I have a donor there testing. So we got off the phone. I called Monica and I updated her and said, listen, this is what they've said. And if the surgeon comes back telling me I should take these kidneys, and I think I should. And she was like, okay, whatever you think. And so the coordinator called back and said, yes, the surgeon thinks you should take these kidneys that are being offered. And just to put this in context, it's February 13th of 2020. So when I'm standing there talking to her, and I was on hold for something, and I thought, what about this virus? There's this virus up in Washington. I wonder if that's going to be a problem. And I thought for a minute, and I was like, probably not. It should be fine. And so, yeah, I obviously had no idea. None of us had any idea how this was all going to go down, but that was ever so briefly on my mind. But it, at that point, it didn't make any sense to factor that in, that COVID was coming. So it's something else that happened right after.
So let me make sure I get this straight. You had 2 people that tested for you that were voluntary donors.
Mm-hmm.
The first one got ruled out. The second one, your blood types didn't match.
Mm-hmm.
You got a call from the Mayo Clinic in Phoenix saying, we have 2 kidneys for you, a pediatric en bloc transplant, which you accepted on the 13th of February.
Yeah.
On Valentine's Day, February 14th, 2020, talk to us about what happened on the day of your kidney transplant.
Yeah. Well, so we arrived early that morning. I'd been told the night before to leave at 11 p.m. We got there, and, I was put in pre-op and waiting, and I met Monica because she was still there and had some appointments that day to talk to the doctors. And so, yeah, she sat with me while my husband went to the airport to pick up our daughter. We were supposed to have gone to Denver that day, and we canceled all of our flights and stuff, as obviously. And then instead she got a flight at the last minute and came because she wanted to be there. And so we were waiting, and I really didn't think it was going to happen. I thought this is probably just going to be a dry run, which is where you kind of go and it doesn't work out. And I thought, well, it's good practice. We know how this works. But then the doctor came in and he said, well, I just need 45 minutes with the kidneys and then we'll start. And I was like, do you really think it's going to happen? He's like, well, I'll go work on them. And I assumed at that point that there was still a pretty reasonable chance that he would look at them and say, like, this isn't going to work out. And so I wasn't too, I think I still didn't want to like get my hopes up and think that it would all happen. Right. And that night before, when they had told me to leave, they said, we're going to call you at 11. And the reason is at 10 is when they're going to remove the organs from the donor. And so at 10, I was thinking, like, what's happening on the other side of this? This is awful, right? I mean, there's a family that has made this decision to give these organs, and I'm sure there were others given as well, the worst possible day. Like I can only imagine it was like the worst day of their lives, right? And they're able to sort through that enough and think about all these other people that they could be helping at their very worst moment. And so at that 10 o'clock time, every year I think about that night before on the 13th of February. And then, obviously my transplant happened the next day around 1:30 in the afternoon or 1 o'clock, somewhere in that neighborhood. And I remember the guys came to take me and I was like, what are you guys doing? And I was somehow thinking the doctor was still going to come back and talk to me. And they're like, we're ready to go. And I was like, we're doing this? Like, I was so surprised. And I kind of started to freak out a little bit. And I looked at Rich and Maddie and I was like, could this be the last time I see them? Like, I was not, the risk is so low for transplant recipients that something bad's going to happen. But like, you still always think, you never know. Right. And so I basically gave them a hug and they pushed something and I was out like really quickly. And I remember waking up, they were trying to do an ultrasound and I wasn't like, I don't even think my eyes were open. And later I woke up by myself and I thought, did they do it? And I kind of felt around to see and I felt a bandage. I was like, oh my gosh, they must have done it. Like, it still felt really surprising. So.
Julie, are you familiar with that recent JAMA study where they talked about the risk to kidney donors, the current risk to kidney donors being less than 1%?
Yeah,
fatalities and
1 in 10,000, right?
Right.
We used to quote the 3 in 10,000 that's the risk, or that's the the donor risk of having a death, and even 1 in 10,000, that's not none. So there is that risk still, but I know it's very, very low, but it's certainly not zero. And so it's, as people were thinking of donating to me, every time I would get a call or a message saying, I'm interested, I've done the form, I would think of that person's family and their kids. And I would think, no, you shouldn't. And then I would think, okay, Julie, you've asked, you've put it out there. Why are you thinking they shouldn't? It's really hard. I mean, it's really hard to think about both, to think from both sides of it.
It just shows how unselfish you truly are.
Well, I mean, to think that you have this thing, right? And they say to you, you need surgery and you're going to need an organ from another person, whether it's a deceased donor or a living donor. That seems crazy. And then you think, I have people calling me and saying, I'm willing to come have surgery with you, right? I mean, I don't know if those are pretty amazing people. I mean, at Square Knot, I get to talk to patients who are donors. They call and ask, questions. And it's my favorite part of the day, always, to talk to a donor. I mean, it's just amazing. Every single time I'm like, regardless of whether you donate or not, it's so amazing that you called, right? And it makes such a difference because we don't tell our patients who called, but we do tell them that someone called. And, as a recipient, to hear that even one person is willing to jump in this with you, it's so emotional and humbling. And, it's very overwhelming.
I was going to ask, have you ever met with or spoken to the donor family in your case?
I have not. I wrote them a little more than a year after, and I didn't hear back, and I think that's fine. I don't know, it might have been too soon. I've thought of writing. I've actually written again. I haven't written and sent, but I've, written the first part of another letter. Um, I think there's a couple, like on one hand, I feel like I would love to meet them and I would, no question. I would love to meet them or talk to them or communicate with them in any way. But, there'll be another level of difficulty to know who it was, to know who this little person was who gave me these little kidneys, and to know, their family, and to see them, and to know that, my donor was probably around a year old. But I don't know. The only thing I know is their weight. I don't know if it was a boy or girl. I mean, I don't know where the kidneys came from as far as location in the country. I don't know any of that. And, I would love to, if they would, if that's something they want. But I also totally understand if it's too hard. Right.
Let's talk about the time following your kidney transplant. Talk to us about the effect that COVID-19 had and what your concerns were as a result of the outbreak. Why did protecting your kidney from the virus become your top priority?
Yeah, it was so scary. I mean, like I mentioned before, we didn't know at the beginning and everything seemed fine. And then basically during my recovery, it was those like 5 weeks after that, where I stayed in Arizona, and I had various family members coming and helping and, being around. And, we started wearing masks. I mean, I was already wearing a mask, but everyone started wearing masks, and sort of, we all know how that progressed. And basically, I was admitted a couple times for some minor things, but the scariest part is when I went to leave the hospital. It was the day the country shut down, right? And so I had this appointment, and the doctor basically says, Julie, these kidneys are beautiful. They're working amazingly well. But if you go out and get this new virus, you could lose them or you could die. And I was like, okay, this is I mean, it's hard enough I think, to get a kidney transplant and leave really immunocompromised and try to sort through, like, how do I manage that, with my family and friends and kids and parents and all the things, right? I mean, people go through this and, try to work it out. But to hear that the day you leave, right? I'm, finally allowed to go back home to Las Vegas, and I'm driving home. I have Rich's aunt Annette with me, and she was such a good sport to stay with me kind of my last 10 days. And, I'm scared to go into a gas station to use the restroom, right? Because I'm like, I don't know, this isn't safe. Nothing is safe, right? And so I get home, and my family, we're all staying in different places. My parents had been isolating. Rich had gone to pick up Maddie at college, brought her home. So she was at our house. I was at my parents' house. He was staying in a casita of a friend of my parents who was kind enough to let him stay. And, all this trying to keep me safe, and I mean, everybody wants to stay safe, but it was so scary, right? I mean,
Yeah.
as they're telling me this, I'm thinking like, I have this huge responsibility, and I keep thinking of this family who gave me, these kidneys, and thinking like, what if I do something stupid that ends with me losing these kidneys? I mean, that would be awful. And, it would almost, at the time, and I mean, I still think this now, that if that had happened, right? Or if that happens, I would feel so terrible that, like, it almost seemed like if it's going to happen and I'm going to get COVID and I'm going to get really sick, that dying would be easier than living with having lost the kidneys that I just received from this family. And so, I mean, that's a terrible way to think, but it was so scary, right? To have to feel that responsibility and that fear. And, it's been so difficult all the way along, trying to, figure out like what precautions to take and not take, and how to deal with, all the stuff that went with this. I still take precautions. There's still things I do to try to be safe. I get all the vaccines. I try to get antibody treatments. I've been in studies, and, I want to do the right thing. I also don't want to feel like I'm not using the gift I was given and, not getting back to doing normal things in life. And I'm still trying to find that balance. I mean, I'm traveling, I wear N95 masks when I travel. And, I joined this really great group of people who, where we were all part of a vaccine study for patients with transplant. After, as the vaccines came out, we were getting blood tests before and after every vaccine to check antibodies and doing all these things. But, it's a lot. And for my family, they spent way more time isolating and working hard to protect me than most other families had to do. And, my my life won't ever be the same. And to some degree, there's really great things about that, like Square Knot. But my things are not the same. I don't have the same social groups. A lot of the way that I deal with most things is online, and it's a hard transition to have that happen right after a transplant when you're already trying to sort through everything being different again. So
Let's talk about your health since the time of the kidney transplant until now. Have you had any issues with your health? Any problems with your transplanted kidneys?
So really minor things, really. I had a urinary tract infection sort of right after they took the catheter out. So I ended up on antibiotics for a little bit, and I was admitted once for some IV antibiotics. I had BK virus that popped up a couple months after my transplant. I was super scared by that, but it really was treated by lowering my immunosuppression, and it went away pretty quickly within a couple months. And then this year actually was when I probably had the bumpiest time outside of just right after the transplant. My white count became very, very low about a year ago, and it kept dropping and dropping. And in December, it became, to the point where they had to do these treatment shots and things to try to get the white count up, and changing my medicines and, all my immunosuppression to try to allow the white count to come back up. And during that time, at some point, they decided, well, they need to look for cancer to see if there's something else happening to cause this. So it was pretty scary for a couple of months there. And I had a bone marrow biopsy, and, which didn't go great. I mean, it went fine, but at some point during that, one of the workers there said, you should probably take off that mask. You're going to be laying on your belly for a while. And, I was like, are you all going to put on a mask then? And that was kind of crickets. I didn't get back on that. So I said, well, then I'm going to keep my mask on. Thank you. And then, during the procedure, they're telling me to take deep breaths, and, none of them are in masks. And I'm like, yeah, I understand. I'm supposed to be taking deep breaths in my N95. So, it was a little rough, and waiting for the results was scary and hard, but in the end, they didn't find anything terrible. They determined it was my medicines, and I'm actually my white count is now improved and better, and so it's really, in the scheme of things, I feel like I've had like the easiest kidney failure story. I mean, I never really got to where my kidneys were fully failing. I received this transplant, and I've had minor complications, really. So, I mean, I've been incredibly fortunate to not, to have it be a pretty easy path, minus the whole pandemic thing.
Okay. You've talked to us about your concerns about going back to work and meeting with Dr. Heher. Let's talk a little bit about your work experience with Square Knot. What are your duties and responsibilities? What is it exactly that you do?
Sure. Well, so the first thing is I'm a navigator. And what that means is I have patients that I outreach to. We spend time with them early on when we first meet them, gathering their medical records. And then we have a meeting with the navigator and Dr. Heer and the patient and their family if they would like. And we kind of figure out where they are. We help make sure they understand where their kidney function is. If they're early on, we help them make sure they understand their GFR and what they can do to preserve their kidney function and to, hopefully never need dialysis and transplant. But if they do, We, make sure that they're referred at the right time. We make sure that there are barriers to kidney transplant have been identified and help them figure out how to manage those things. For example, if their BMI is a little too high for a transplant center to list them, we make sure they understand that before they go there and try to work on that. If they're smoking or if there's other issues that need to be addressed, we like to do that very early. So by the time they reach the transplant center, we hope they've dealt with barriers. We've helped them find a living donor. So I work with my patients to create, just what I did, something on social media or a letter or an email or whatever they're comfortable with, to put out into their community, because, getting it out to their people wherever they are, like 93% of donors are found in your circle or in your friends' circle. So, trying to get it out to people you don't know is not as effective as getting it to the people who know you, because they're more likely to share it, and then they're, more likely to be interested. So that's some of it. And then, once we have that plan in place, we, if a patient's being referred to a transplant center, we also like to help them pick the transplant center. Which one do we think you're most likely to get listed at, that your insurance will let you go to, that's convenient for you? So we spend time, figuring out their insurance, figuring out their situation, figuring out, can they travel, and sort of taking them through all of this. And, during our first meeting with Dr. here, all together, and, he's looking at all these barriers and he's looking at their records and medically, assessing, are they a good candidate for a transplant? And, we've had times when people are not, and we have to have those hard conversations too. But when they are, we take them through and we're with them. They can call us anytime, to ask questions, talk about worries, if they need something faxed, records, or if the transplant center, they may call us and say, hey, can you get this for us? Can you help the patient arrange this? And so we communicate with the transplant coordinators. We communicate with social workers at dialysis units, with physicians' offices, hospitals. So we're doing a lot of care coordination and helping patients, make sure that, sometimes patients will say, well, I don't know, they referred me to a transplant center. All right, well, when did they do that? I don't know, last year. It's like, well, have you talked to anybody? And, they don't know that they have to follow up, and that, stuff falls through the cracks. And, maybe they went to check their insurance and it didn't work out, but no one told them. There's so many things that can derail it. And so we just make sure that doesn't happen. So we spend a lot of time, working on those sorts of things. And, as a navigator, really, whatever their problem is, we try to help them problem solve through it and navigate healthcare, navigate the system, navigate transplant, whatever it is, and try to help them get through in a way that's less difficult.
Okay. If someone wanted to reach out to Square Not Health, I know you guys have a website. What is the address for the website?
Yeah, it's www.squarenothealth.com, and it's square like the shape, and then KNOT like a knot, on a rope, and then health.com. Is
there a telephone number that people could use to reach out?
Sure, there definitely is. It's on there, and it's 617-468-4245. That's our main number. And really what happens if you call there, you'll push number 1 and you'll get me. So feel free to call. I'd be happy to speak with anyone.
Okay. The number again, 617.
617-468-4245.
And hit 1 to talk to Julie.
Yeah, that's right.
Okay.
That's right.
You mentioned to me in our exchange getting ready for this week and this broadcast about the support that you have. Can you talk to us about your sources of support?
Sure. Yeah, it's interesting. This has been so important, right, to have people to talk to since early on for me. And, for getting kidney support, I mean, obviously my family and friends have been amazing. I have, people that have so stuck with me through all of this with the pandemic and the isolating and all of that. So of course my family has been terrific. But for kidney support, my favorite place to go is to Kent Bresler's group at Kidney Solutions. And I Monday nights, I almost always go. I can't always make it, but most of the time, for his support group with Shannon and you and this. I mean, it's such a wonderful group of really sweet and kind friends and mentors, and they're willing to talk about anything to help people through. My favorite memory from there is the first time I went, there was a woman on there saying, I'm going for my transplant evaluation tomorrow and I'm so scared, I'm going by myself. And this other guy said, well, which hospital? And she said, and then he goes, oh, well, that's my transplant hospital. I got to go there this week to pick up my meds. I'll just meet you there tomorrow. And I was like, these guys must know each other. And then they tell each other their names. And I was like, they don't even know each other. And it was just such a good illustration of what a generous and kind community, Kent has built with all these people that come and, are looking to help. They're looking for help. They're looking for support, but they're also looking to help and provide that support to other people. It's just great. Like I love going there. I often go and listen. Sometimes I jump in, but it's great. I also do run a support group here in Las Vegas, and we have one meeting a month online and one meeting a month, not always every month in person. And that's a great place. I've got this really awesome group of friends who live here, and we moved online during the pandemic, and it's really also another really great resource for people here in Vegas. And our online group is open to anybody too, so anybody can come for that.
That's the Living Well with Kidney Disease support group.
That's right. And then,
and by the way, folks, just so you know, all of this stuff that she's going to talk about, the links, the phone numbers, all of that is in the comments to this broadcast.
That's great.
Okay, I've laid it all out for you so you can find Julie or find support if you need it.
That's great.
Go ahead, Julie. I'm sorry.
Yeah, no, it's totally fine. I'm so thankful. Another place that I went, I spent a lot of time at Renal Support Network and at their events and their support groups and their classes and other things that they have online during the pandemic in particular. And that actually is where I met Lauren, the person who introduced me to Dr. Here. She happened to be moving to Las Vegas, and I was so fortunate to meet her in this support group that neither of us attended on this day regularly. And she kept bugging me to go talk to him. And, I finally did. And it was, the best thing that has happened to me since a long time. And I had a kidney transplant, a pediatric en bloc kidney transplant. And so, I was so lucky to meet another friend who, put me in touch with this amazing new friend, Dr. Here. I mentioned before TRAPAG, which is an organization to help people who are immunocompromised learn more, be advocates for things that we can do to be safe. And it actually came out of this vaccine study group, and it's a group on Facebook that Janet Handel created when we were all in this. It was the Johns Hopkins vaccine trial for transplant patients. And so we were all getting tested before and after our vaccines. And during one of the webinars that Hopkins put on to tell us how things were going, she said, hey, everybody, in the chat, she just said, I'm going to make a Facebook group so we can all talk to each other offline. And now that group has grown from about 50 people in the beginning to over 2,000 people who are continuing to talk about, how can we be safer? How can we get the vaccines we need or the treatments that we need? What are other tools and things we can use to stay safe while being immunocompromised during, COVID and now, just in life. So that's been a great place for support. And actually, I met one of my colleagues there, Rachel, and I have two brand new colleagues that I also met there, Jullie and Libby. So it's been such an amazing resource. I also meet up with a couple of other small groups. Risa Simon and my friend Rachel have put together groups where, they're just smart people getting together and talking about all these issues that patients who have transplants and who are immunocompromised, how we manage and how, what we should be advocating for and, how to do that. I love Rachel's group because it was sort of focused on, we're all grateful. I'm so grateful. I'm grateful every day. and I feel my kidneys every day because they're a little bigger and, different than normal kidneys. Normal people, I think normally you don't feel your kidney, but I feel it all the time. And I feel that, so grateful. But also, it's okay for us to complain when things don't go perfectly. And there is a lot of that. Like, there's a lot of complications, there's a lot of things that impact your life, medication side effects, all kinds of things. And so being able to come and know that it's okay to talk about those things and not feel bad that we have some things that, aren't perfect. It's a really good resource. So I appreciate both of them for, making these little groups that we can spend this time talking. And of course, my favorite place to go is Square Knot. Um, my friends and colleagues there, I mean, they're just the best. Elliot, Lori, Michelle, Rachel, Katie, my friend Dan. Um, I met him there, and he's a recipient. He's a pharmacist. He's so smart, and he's taught me so much about data analysis and collection, which has allowed us to. We have at ASN Kidney Week, we've submitted an abstract, and we're going to be presenting all of the Square Knot Health data that shows that our model works, right? And so it's been so amazing to meet all of these people and to have these, great supporters and friends. And, of course, Dr. Here thought of this idea that puts us all together, and it's been the best thing.
Okay. Let's talk a little bit about your advocacy efforts. And I love your take on this. You refer to it as your efforts to give back to the kidney community since you were transplanted. Can you talk to us a little bit about that?
Sure. Well, so I am involved in the PKD Research Resource Consortium, and it's a patient engagement group is the part that I'm involved in. And it's been so interesting. I really didn't know very much about the basic science and how much effort and time go into all of that. So this is like the preclinical trial, it's helping the researchers, understand the basics of how PKD works, the cells, the genetics. There's so many resources that they, have that then they can provide out to researchers who are doing projects. And so it's been super interesting to listen to all of these amazing researchers, figure out how to make these resources available. And the patient engagement group is there to help kind of keep the patient voice always around and always in mind. And we've done presentations, and we have joined some of the committees within the consortium, to learn and also to bring back information to the rest of the group, but also to contribute when we can, and give the patient's thoughts, one representation or the group's representation of what we think, priorities are, or the way that we think about things. So it's really important to recognize these guys. They're the guys that are making it possible for, all this other research down the line to happen. And Dr. Reem Mustafa and Dr. Lisa Guay Woodford are the facilitators for that group, and they're both amazing physicians and researchers, and they're really dedicated to making sure the patient voice is heard. So that's also been really fun to be part of that group. I have been in a lot of studies. I love being in studies. I always say yes, if I can, to being in one, just because I know it's so important. It's, if we don't do it, who will do it? When I first joined the tolvaptan study, my primary care doctor was like, I don't know if this is a good idea. I mean, what do they know about this? And I'm like, look, I get it. It's your job to protect me, but this is so important, right? I'm looking at my daughter and I'm thinking, we have to do this. Like, whatever risk I'm going to take is worth it. And I didn't feel it was that risky. There are certainly times that I might not join a study, but I love doing that. I love being part of the solution rather than waiting. I'm not a big fan of waiting around for things to, come to pass later. I have also it's been interesting. I've written a couple of kind of blog posts and One of them was about sort of this stuff about the clinical trials and what made me want to do that. And the PKD Foundation was I love the way they did it. They published it on Mother's Day, and it was, how a mom, was motivated to get involved in research. So that's a really nice article. I think it's still out there.
It is.
Yeah, Renal Support Network also published my story a while ago and a few years ago, and they were super kind to put that up. And again, if the story helps anybody in any way, I'm happy to do it. The NPR interview was really different. It was they were thinking about trauma and talking about that and talking to experts in trauma. And the questions they asked were, do you think that you have experienced trauma being an immunocompromised patient in the midst of COVID? And at the time, my answer was, that doesn't seem right. I mean, I know what trauma is, right? And that didn't seem to fit just right. I don't know. I feel like they're in some hindsight, how traumatic was it? There was some trauma that happened, hearing, that you could die if you go out and get this virus. I mean, those sorts of things are traumatic to hear. And, it was really hard, I think, for patients to deal with this. I mean, lots of patients, there was so many conflicts, a lot of things became political. It was really hard. And I do think that when we look back in 10 years, maybe we'll say, yeah, I think that was definitely really traumatic. So I don't know. I was in a Las Vegas Review Journal article, and that had to do with when we were really advocating to try to get additional vaccines and antibody treatments, make them available. Here in Vegas, it was impossible to get them. And somehow I got in touch with some folks, and it kind of moved things along a little bit, which was great. I mean, I had a guy at the pharmacy board that was super helpful and got things going. So we ended up with a clinic here where we could go and get those preventive antibody treatments early on, which was amazing. So I did have an article that I wrote for a patient voice article for the American Society of Nephrology relating to a pain scale for PKD. I think there's better awareness of the pain that people with PKD have with their big kidneys, but it's still not entirely recognized. And I think it's really important, to have ways to measure it, and to improve talking about it, So it was an interesting topic to write about. And then most recently, Risa Simon's book, she published a new updated version of her book, and it was exciting to have my story there and see it there. That actually just came out very recently. And I actually will have a publication that has my name on it, along with my Square Knot Health colleagues, Elliot and Lori and Rachel and I. Submitted an abstract to ASN. And so that will be published after Kidney Week, after we present a poster session of our data when we're there. So.
All right. I just want to mention to the folks, Risa's been on the broadcast 3 times, as many of you know. Risa is coming back on November 22nd. She wants to do something a little different.
I heard about this.
She wants to interview me on my broadcast, because for some odd reason she doesn't think I get enough publicity, which those of you that follow your Uncle Jim know, God, I'm every damn place. So, but I'm going to let Risa do that. So we're going to have
I'm so excited.
We're going to have a talk on the 22nd. She's going to interview me as part of the broadcast. Julie, do you have any final statements that you would like to make to our audience tonight before we conclude the broadcast?
Not necessarily, but I do want people to, one, know their GFR, and I want them to reach out and find other people, right? I want them to find, I don't know, it doesn't have to be one of these groups, but anybody that they can get in touch with that's in a similar situation. You can call me, you can call Kent, there's lots of people to call, but find somebody to talk to, find someone to commiserate with, and to to be your kidney friend or support person. It's really important.
Okay, well, Julie, I want to thank you so much for coming on and talking to us tonight. Just a fabulous interview, so much information, and I learned so much tonight listening to you and your story. I'm sure that our audience, their perceptions were raised, and awareness was raised tonight about kidney disease, about polycystic kidney disease, about um, uh, taking part in studies about vaccines, all sorts of things that you mentioned tonight. And I'm very, very grateful that you would come on and help educate us and enlighten us the way that you have. And I just want you to know I appreciate you hanging in there with your Uncle Jim for an hour and a half. Oh my God.
How did this happen, Jim? Thank
I
you
don't
so much for
know.
having me. It was an honor to be here for sure, and I'm so grateful.
Okay. I'm going to let you go. I have some things I have to button up with our audience, who's going to be on next and stuff like that. But I just wanted to say thank you again. What a terrific job.
Thank you, Jim.
Just a great job. Thank you so much, Julie.
Of course. Good night. Thank you.
Good night, Julie. All right, everybody. That's our broadcast. Next week on October 11th, our guest is going to be Elizabeth Kay. I met her at the American Kidney Fund Action Kidney Week, where we all went up to the Hill and talked to our members of Congress. Elizabeth's a radio personality, a kidney patient, and a terrific kidney advocate. So it should just be one great broadcast, and I'm looking forward to it. And again, I want to thank our good friend Julie tonight. Wow, what a terrific job that she did, and just a great educational experience for all of us. So I will see you again next week, and thank you for watching.